Hi everybody, thank you for joining us. We will make a start, but I'll keep an eye on the waiting room as there'll be more people coming, I'm sure. But good afternoon, welcome to our monthly Community Mental Health Transformation webinar. I'm Megan G and I'm the Communications Manager for the Community Transformation Programme. And today we're going to have an update on the developments in East Sussex. So thank you so much for joining. And I'm joined by my presenters today, which will introduce themselves shortly. But we're just going to kick off with a little bit of housekeeping just to make sure that we're all comfortable and know kind of what we're doing today and can also enjoy the session. So as always, these sessions are recorded. So if you do also want to watch it again, you're very welcome. But also if you've got colleagues, contacts, friends who would also be interested in this work, there will be a link which you can share with them. And it gets added to a playlist of all the previous webinars that we've been doing over the last couple of years. So if you want to have a little refresh on kind of the work to date, you can also watch that back there. And because the session's being recorded today, whilst you're obviously very encouraged to obviously have your camera on and participate, however you're happy to, and please don't feel obliged to have your camera on if you'd rather not, and also feel free to anonymise your name if you prefer to, just for the purpose of the recording, just whatever you're most comfortable with today. If you want to turn on captions, you can do that by clicking on the three dots at the bottom right-hand corner of the screen. There's a button that says more, and then if you click captions, that will then bring on live captions for you. We're going to have approximately 30 minutes of presentation today, and then at the end, we've set aside time to allow you to ask any questions that you've got for our panel. So if you do have any questions throughout the session, you can either put them in the Q&A box, you can put them in the chat, or feel free to obviously hold them for the end, and then feel free to obviously come in and you can ask your questions using the raise hand function. And after the session, I'll send an email around to everyone who's registered, which will include a link to a very short survey, which is really helpful if you can complete, because we've been doing these webinars for quite a long time now. And it's just really helpful to get people's feedback about the format, kind of how it's working for them, anything that we could do that we're currently not. And also because this is a slightly new format in that we're going to be having place-based updates on an alternating basis, it's also really helpful to get your feedback as to how that's kind of working for you and whether it's kind of what you want really. So hopefully that's all helpful. And then lastly, as I said, all the previous webinars can be watched back. There's a QR code on the screen now. I'll also circulate the slides around. So if you want to use that later on, please do. And yeah, feel free to obviously watch the videos back if that's helpful. I'm now going to hand over to our presenters. So I'm going to introduce Ian, Andrew and Richard. Did you want to introduce yourselves and then we'll start with the presentation? Thank you.
Yep, thank you, Megan, and hi everybody. My name's Ian Dyer. I am the Programme Manager for Mental Health Integration in East Sussex. I work across East Sussex County Council and NHS Sussex, and I provide some of the sort of project management type support for delivering the Community Transformation Programme in East. So that's me, thank you.
Thank you. Hi everyone, my name is Andrea Potter. I'm the VCSC Mental Health Transformation Lead working in East Sussex and Brighton and Hove. And I work as the voluntary sector representation within the transformation and also work within the central team, helping them to develop the transformation model, and also work to help support my colleagues around the VCSC mental health network that we run as well.
Hi everybody, my name's Richard. So I'm a grandly titled expert by experience with the Trust, and I sit on the operational delivery group for the transformation programme. I do other things as well, including working on the build of the new hospital at Bexhill. So there's some linkage across there. Nice to see you all.
Great, and I think I'm going to kick things off in terms of the presentation then. So we thought we would start at the beginning. I appreciate many people have been with us for a long time through the journey of community mental health transformation, but also that other people are just joining on the journey. So for those people that haven't quite heard about where it's coming from, we just thought we'd start for a couple of minutes right at the beginning. So thinking about where community transformation came from, it's really been in response to a picture across the country of really increasing demand for mental health services at the same time as resources to deliver those services have been less able to be increased to meet that demand. So there's a real strong need to think about the resources that we've got across all of the country, but particularly here in Sussex and East Sussex. There's a real strong need to think about the resources that we've got available and how we can make best use of them by bringing all of the offers together in the community to work together much more effectively. That's really what the Community Transformation Programme is all about. Like it says on the slide there, we know from a lot of engagement that we've done around the programme that people generally think that the services that exist are the right ones. They are able to respond to the needs that exist, but we know that they don't really work together very well. And in that process of not working together very well, it creates a lot of gaps, a lot of opportunity for people to actually miss out from getting the offers that they need. So we know that we need to get services that exist to work better together. We also know that it can be really hard for people to actually work out where to go because there are so many different services and so many different criteria that services have been operating to historically. It can be really hard for people to understand who provides what, where people should be going to first to ask for help, what sort of help is available, how long people might have to wait for it. All of these things can be really difficult to find out and make it difficult for people to get to where they need to be in terms of having an offer that helps them with managing their mental health needs at any point in time. And it's not just that people needing to access services find it difficult. We know that staff that work in the system also find it difficult to understand how the system works and how to guide the people that they are working with through that system. And that becomes a source of real frustration for staff as much as it becomes a real problem for people needing to use services. So that's why we think that changes need to be made. If we can move on, please, Megan. I guess we can talk a little bit about some of the national context of when, in terms of how we're being asked to make these changes. This slide talks about the publication of the NHS long-term plan, and alongside that document that came out in 2019 was a much more focused, specific plan NHS England also produced around community mental health. They called it the Community Mental Health Framework, and it gave a very clear set of ambitions and objectives that individual, what we call integrated care systems that operate around the country were asked to deliver against. And the Community Mental Health Framework is really the driving document behind the programme of transformation that's been embarked upon across the country and specifically here in Sussex as well. And it laid out a lot of ambitions around improving services for people with long-term severe mental illnesses, with particular conditions really focused on, such as eating disorders, complex emotional needs, and people with generally psychotic illnesses needing rehabilitative support. We've been asked through the framework, as I talked about earlier, to try to address those gaps that we know exist between the way that services operate that sometimes do allow for people who don't fit the criteria of existing services to end up without being in receipt of any offer at all, despite the fact they clearly need something to support them. We've been asked quite rightly to address that issue and to ensure that anyone that needs support has an offer that they can access. And really, like I said at the start, the main focus around how we deliver these ambitions is really about bringing together those organisations, those services, those offers that already exist to bring together in a much more integrated and joined up way so we can really make the most of our whole system level of resources from across the NHS, excuse me, voluntary community offers, public health, adult social care, bringing everyone together to work together more effectively. If we can move on, please, Megan. So in Sussex, still just talking about the beginnings of all this work, really. Right at the start of some of this work, we knew that we were going to need to do this. for the reasons I just laid out. There was lots of engagement work that happened right at the start of the program around, well, how would it make sense to do it in Sussex? How do we make sure that as we do this, we respond to the needs that are specific to Sussex and, of course, East Sussex? Through that process, we came up with a set of shared principles by which that we wanted to, as we develop a new model of community mental health offers, we wanted to ensure that model adhered to these principles that are on the screen here. So making sure that we can provide what we call personalised and complete care, really making sure that everyone involved in the care, support and treatment of someone with mental health difficulties is taking a no decision about me without me approach. That we are delivering services in a way that we're calling simple and seamless, really trying to adopt that no wrong front door approach to help with access and to make sure that once people are being supported by any part of the system of our mental health services, that they can then navigate their way through that system really easily, really simply, and in a way that responds to them as their needs change, rather than expecting people to have to sort of work around a system offer that doesn't fit them. Making sure that services are accessible and inclusive, so ensuring that we provide high quality, evidence-based treatment and support options for people, that we do so in a range of what we said there, welcoming environments that are as close to home as possible is a really key aim of what we're trying to achieve. And going back to that idea of bringing existing service offers together more cohesively, we really want to take that one team approach so that anyone needing support with their mental health experiences the offer that's provided through them locally through it, as if it's being provided through one team working together rather than lots of different organisations that don't talk to each other. They're the main principles that we wanted to try to hold on to as we went through the journey of transforming our community mental health services, and to sort of talk about how we've embodied some of those principles, particularly around working with others to deliver the one team sort of approach. I'm going to introduce Richard to talk about some of the co-production work that we've done. So over to you, Richard.
Thanks, Ian. Can you just give me a wave to make sure that you can hear me today? I had a problem with that yesterday. Can everyone hear?
Coming through fine, Richard.
Lovely, thank you. So hi everybody. Yeah, my name's Richard. I'm an expert by experience with the Sussex Trust. I've been so for a few years now, but I entered the mental health care very, very late in life, having had no contact with it. Since I've been able to look back on that experience and understand how it did or didn't work for me. As it happened, I met some fantastic staff along the way, but always seemingly up against it because of the systems that were placed around them. I'm doing this work on behalf of other experts by experience, and it's only my own experience that I bring. So, which sounds obvious, but I never try and speak for everybody, and really conscious that we don't always capture everybody's voices. That said, the Lived Experience Advisory Group run by Possibility People helps to bring in other people into other areas of this programme who have got real expertise, people who have been homeless, people who are carers, people who have had extreme mental health problems for lifetimes. Which I haven't experienced. So it's sometimes tricky trying to bring all that together. What I will say is that I'm not getting involved in anything where I think that experts by experience are only there as a token. It's not what I would want to be doing, and I would step away straight away. This program is definitely not that. Although it's been sort of imposed from the top, the framework, etc., has sort of come down, and I've no idea how much service user input was involved in that. The minute it arrived here with the team, we were involved as the Lived Experience Advisory Group, which meant that there was a real impetus behind it. And I see my job mainly as kind of, for a start, making sure that this is timely, that it's neither going too fast so that things or service users particularly might slip through the gaps, and neither going too slow that this is another NHS process that is taking forever because of endless meetings, and so that is a big part of the role of being in there. We're talking about inclusivity, and this isn't around the diversity issue, really. It's not so much about that. It's just making sure that every part of our county can access this new system, and that it isn't designed just for the bulk of the people. And that's something that's got to be constantly looked after, especially around the rural considerations, people's transport, being able to get to appointments, people being able to access specialist services as well. So that's something that's really foremost in our minds all of the time as a team, and not forgetting staffing considerations as well, because we appreciate how important the staff are in our care, as a joint approach to our care. We do think about how this can be implemented best for service users at all turns. That said, there's obviously a lot of systems that need to be changed, need to be improved, but I'm feeling really confident at the moment that this is going in the right direction for the right reasons. And if you get a chance to review the principles that Ian spoke about earlier on, there's nothing in there, not a single word that I feel I could disagree with or question. It's exactly where we should be and exactly how we should be receiving our care. With that in mind, I think it's really important that if anybody, and I'm sure that there are other people here who've got lived experience or have got experience of other people who have had mental illness, then please feel free to get involved through the Lived Experience Advisory Group, because the more voices, the better. And the team take those voices and comments on wholly. So that's where we are at the moment, and very happy to give updates as we go along. So I'll hand you over to Andrea now, I think, for the roadmap.
Brilliant. Thank you, Richard. That's great. Thank you. So yeah, I wanted to talk to you now about kind of what we've done at East Sussex level. So as Ian mentioned earlier, what's happened within the transformation is that the phase one was really focused on the development of that new mental health model for Sussex, and the development and design of that model happened at a sort of Sussex-wide way, and bringing people together across Sussex. And we're really moving into phase two now, the transformation programme. It's really focused on establishing place-based leadership groups to really plan and design and look about the delivery of that neighbourhood mental health new model now going forward. So what we've done in East Sussex is work has taken place to establish that place-based team, and we've got the operational delivery groups that come together and is made up of representation of organisations across the system. And what they do is they meet monthly to look at how we are going to plan and deliver the new model. And one of the first tasks we did was we looked at what we would need to do and some of those key activities as we developed that plan. And we've drawn up this roadmap that you can see, which really outlines kind of what we need to do, what the priorities are, and when, to really make sure that we hit that kind of final destination, which is having that new neighbourhood mental health team model fully operational by March of next year. So as you can see, the kind of key first task was around thinking about that leadership team, which I mentioned, establishing that and bringing people together to be able to plan and deliver. And then the next task was really about really agreeing those locations for that new model, so those footprints that we'd need for the new neighbourhood mental health teams. Also sort of moving forward around building those new teams and thinking about the kind of governance and data reporting requirements and processes that we need to be able to, when we have those teams, be able to report back and ensure that we have the leadership and the governance that we need for them. And then working into kind of starting to establish those aligned working practices from October of this year. So bringing those teams together in that one team approach right through to kind of March of next year, of having kind of the full team kind of fully operational and fully aligned by March. So that gives you a kind of an overview of the sort of key tasks and the dates of when things will happen in East Sussex. So if I can have the next slide, please, Megan. So as I said, in terms of kind of the detailed work that we've done, what was done at a Sussex level was around the design of that new model, which you can see here on the left, which is the neighbourhood mental health team model. Many of you may have seen it before, but for those kind of who haven't, what it describes is that it's really about bringing services much more closely together, as Ian mentioned at the beginning. What people don't want a new service, they want existing services to be much better connected. So this is what the sort of new model does, bringing together NHS, the voluntary sector, local authority, GPs and primary care as one, as a neighbourhood, and really building those strong working relationships, connecting people together, improving those communications between the teams, and really making sure that we have a kind of real broad skill mix as well that we're able to offer to help support people. And as you can see on the diagram, it's really about the different layers of support that would be available to people as well. So ensuring that we're helping support people right from the beginning, when people might be looking for kind of advice or information at the beginning of sort of a journey around support they might need around their mental health, right through to that kind of specialist support that people might need as well. So bringing all of that together as a neighbourhood team in a local area as well, that local expertise. And then in terms of how those neighbourhood mental health teams will be structured, you can see on the right-hand side, so it's a little bit squished there around kind of the structure of the team. So we're talking about having a core team, aligned services, and on the outside as well, that kind of wider network and partnerships as well. So the core team is kind of made up of those kind of key mental health services. The aligned services is really thinking about how we would bring it in and connect with kind of wider support in terms of physical health services, social care and housing, bringing that much closer together with mental health and having those strong linkages between them. And then the wider network, so really making sure we can connect with the kind of community assets that exist and thinking about the other things that help keep people well as well. So for instance, sports and education offers, arts and culture, and really having that connection between them. So that's what the kind of mental health team model looks like. And then if we could have the next slide, please, Megan. So going now into kind of what we've done within East Sussex to create that team as well. So as I said, the model was designed at a Sussex level, and then it's passed a kind of place to think about what that would look like and what the services would be within that kind of core team, the wider team, place-based level. So what we've done in East Sussex is we've devised a selection and allocation process for sort of deciding who would be part of our core team, and really giving that kind of thinking about the eligibility and the rationale for who we need to be in our core team in East Sussex. And we went through a process as a operational delivery group to really decide who's going to be joining and when as well. So as you can see, that happened, and we identified the services that could start operating as a neighbourhood team from October, and we were aware other services would join as well when they're able to. But from October, we have identified that in the core team in East Sussex will be the emotional wellbeing services that operate, the assessment and treatment service, and including also the specialist older adult mental health service, the access facilitators and screen to intervene. So this is a service that looks at helping support people with serious mental illness to ensure that they get their physical health check and thinking about their physical health needs. The employment support service as well, so the service that operates around supporting people with mental health to gain employment or be able to continue in employment. Mental health social prescribers that exist, and that includes the sort of the voluntary service mental health social prescribers as well. So bringing those together initially as that core team and ensuring that we have that connection between those services. And then the other kind of key task that was identified was how those services are going to work together going forward. And on the right hand side, you can see there that it's really about bringing them together and building those relationships and the meetings that will need to take place to help build those connections. So we've got some meeting ideas there around kind of bringing people together where appropriate around a kind of daily huddle, thinking about what might need to take place around triage, thinking about and also those kind of provider meetings as well, so we can make sure we have those connections really fully established and that people have that opportunity to have those connections, discuss kind of what would be happening with people, support people in parallel, and have the opportunity to work together much more closely. So that's the kind of work that we're doing around building the core team and building the kind of meeting framework that needs to sit alongside that as well to build those connections. So the next slide is around the next kind of key piece of work that we've done, which is around deciding the footprints for the neighbourhood mental health teams in East Sussex. So those have now been decided, and you can see there on the visual, the map shows kind of what those will be. It's going to be 5 neighbourhood mental health teams, and they're going to be in Lewes, Wilden, Eastbourne, Hastings and Rother. And a piece of work was created by the operational delivery group to do an options appraisal to ask people what their thoughts on would be in terms of the footprints. So that process ran for a period, and we asked people to have the opportunity to feed into that and give us their views and scores on what they should be. And what came out of that is that people overwhelmingly wanted to ensure that the neighbourhood footprints that we used aligned with the integrated community teams boundaries. So this is another programme that's taking place, really looking at making sure that there's strong links in terms of physical health and all the other kind of services that exist as well, so including mental health. So I thought it was really important that we ensure that we do align with those ICT boundaries. So that's what we've done within East Sussex. So we've got the 5 neighbourhood mental health teams that will align with that. And that's to ensure that, as we said, we're making sure that there's that full service offer for people. We've got that strong link between mental health and physical health too. So thank you. I'm going to have the next slide, please. And then just wanted to kind of really talk about kind of in terms of when we are delivering that new neighbourhood mental health team model, what the kind of benefits are going to be for people in terms of service users, families and carers, but also for staff as well. So we heard at the beginning some of the things that people wanted from the new model and the rationale of why we wanted the change to happen. So we're hoping that by delivering the new model that there'll be real benefits for service users in terms of make it much easier for people to access the support. So we heard that people find it really confusing about knowing where to go. We're hoping by implementing the new model, it'll be much clearer around how people can access the neighbourhood mental health model. There'll be kind of clearer access points and more consistent messaging of where to go for help. So really removing that confusion that people have and the inconsistency that we currently have around where to go. Also, I hope that it will help to reduce waiting times for support. So another kind of key thing that's been fed back that people find really difficult around how long they have to wait. But by bringing professionals together much more regularly and much more connected, we're hoping that, it will reduce the time that's spent being passed back and forth between different services and mean that people can get help much more quickly. Also within the new model, it's a move to make sure that, it's an open access model that people will be able to get help regardless of diagnosis. It's really going to be based on need so that there won't be a wrong front door for people. People can come in and access and get the help that they need much more quickly. And as I mentioned before, it's about those easier transfers. By bringing professionals together regularly, people can, there can be warm handovers between services, not long, lengthy referral processes. There'll be a real focus on ensuring that more people can have those physical health checks that I mentioned via the screen to intervene and the access facilitator role. And also more VCSE involvement. So this is, a key part of it, that we're going to bring together kind of the clinical services and the voluntary sector together and ensure that people have access to much more wide range of support as well, and to really meet the kind of wide range of needs that people have. So this benefit for sort of service users, families and carers. And then in terms of staff, so hoping that, it really leads to improve staff satisfaction in terms of the role that they have. So helping to increase the confidence that staff have about the different types of support. So expanding their knowledge about what's out there and how people can work together to support somebody rather than in isolation. And as I mentioned around, really reducing those lengthy processes and referrals and admin tasks that sometimes are needed at the moment as we work in silo around passing people between, but actually being able to have conversations about how we can help support people together. And ultimately as well, sort of reducing that admin time, ensuring that staff have more time to actually spend with service users in delivering that support. So I'm going to have the next slide please, Megan. I'm going to hand back over now to Ian just to talk about kind of how you can be involved within East Sussex around as we kind of work to deliver the new model.
Thanks, Andrea. And apologies for sound issues earlier. Hope they are fixed for everybody now. Yeah, so we are really, really keen as we move through the journey of transformation that we include voices from as many stakeholders, individuals, groups, and forums as possible. We've established a number of spaces where we hope we can help invite people to come and join us and be a part of the work. Probably the most significant is the Community Transformation Partnership Group, as it says there. It's a very open stakeholder reference group. And it's established to give people the opportunity to input into all the plans that we have put together and to input into the way that they are implemented. In East Sussex, we had a partnership group meeting yesterday where we went in detail through the sort of project plan that we put together around the work that we need to do to get people's input, make sure we haven't missed anything, make sure people are clear around what we're doing and it feels appropriate. So those meetings are open to anyone to join. I tend to support them. So if anyone would like to be a part of that group, do just let me know. I don't know, Megan, if contact details are being shared or if I can put things in the chat so people have my email address, but do please get in touch if you'd like to be part of that group. Yeah, it's very much an open stakeholder group, as it says. I'll come back to the survey last, if that's okay. I'll just sort of stick on the opportunities to be part of groups. Richard talked about the Lived Experience Advisory Group, and always looking for new members to join that space. So anyone that's got lived experience of living with mental health issues, needing support with mental health, caring, living with someone who has had those experiences and would like to be able to use those experiences to share with us across the system in East Sussex to help the development of mental health services generally. It's not just focused on the community transformation piece of the League, it's about anything to do with mental health service improvement and change in East Sussex. Anyone that would like to be a part of that, always looking for new members. Ricky Perrin, who's on the call today, is the coordinator of that group. And again, perhaps Ricky might be able to put his details in the chat. People can get in touch with Ricky if they would like to be a part of that group. And then we've got the VCSE Mental Health Network, which Andrea's colleague Rosie coordinates for us, and that's a real opportunity for VCSE organisations particularly, so that's voluntary community social enterprise organisations, not-for-profit and charitable type organisations. So it's a space for those organisations who form a massive part of the overall offer of mental health service delivery across East Sussex. It's a space for them to come together and again really be included within the work of the transformation programme. So any organisations, anybody working for an organisation that would like to be part of that, I expect Andrea is your best point of contact to start with, who can link you in with Rosie if you're not already. So just to come back to the community survey bit, the second sort of pink title there, we've been working for the last couple of months with what's called the Consultation and Insights team with East Sussex County Council, who do a lot of work around, as the name suggests, working with the East Sussex population to understand people's views on anything around adult social care and health, really. We've worked with our colleagues to put together a survey that was actually thought about and agreed through the Transformation Partnership Group that's really looking at what is it like right now for people who need to access mental health services in East Sussex. What's the process of accessing those services like? Does it take a long time? Do you get an offer that you need? Do you get an offer that you can actually access because it's close to you, or are people being given offers that they can't access? Are people getting any response to requests for support? All these things, we'd like to know what it's like for people now. So anyone that's been trying to access services for themselves or someone they care about in the last 6 months is invited to take part in a survey and tell us as much as they, or as little as they want to, about that experience, that we can then use within the partnership group as a quasi baseline, if you like, a way of understanding what the situation is now, so we can understand that as we go through the transformation program, as we introduce the neighbourhood mental health team model, well, if we come back in 6 months' time maybe and ask those questions again to the population, does it look like things are getting better? Are we making the changes that really need to be made to help people get the services that they want? So that survey will be going live later this month. We'll probably leave it open for about 2 months for people to respond to. We'll be sharing the links far and wide. Yeah, anyone that's interested in taking part, we really would recommend everyone that takes part that wants to, and anyone that can support people that they work with to be able to access a survey and complete it would be fantastic support for us to really understand what's happening there. I think that's it from me. If we can move on to the next slide. I don't know if you're picking up these last bits, Megan, or...
Yes, that's me.
Yeah,
thank you
thank
so
you.
much to Ian, Andrew, and Richard for the presentation. I think it's brilliant to see the detail of the work that's been happening in East Sussex. So hopefully everyone joining the session today has found that helpful. I just wanted to give a bit of an overview as to the ways that you can get involved with the programme across Sussex. So if you are working across a number of different areas, or maybe you're not located in East Sussex but wanted to join today out of interest, then obviously you can continue to join the monthly webinars, and next month is going to be providing a focus on the updates in West Sussex and the progress in that area. We've also got the monthly newsletter, so if you aren't already subscribed to that, please do so, and I'll include the link in the email that I circulate around later today. As we discussed at the beginning of the session, all the previous webinars can be found in the YouTube playlist. We've already spoken about the BCSE Mental Health Network, so if that is applicable to you, please do get involved and join. We've also got a web page which is hosted on the NHS Sussex website, which has all of the latest news and information about the Community Transformation Programme. So if you haven't already had a look at that, do check it out. And you can also get in touch with us. We've got a central team email address. If you do have any questions about the programme more broadly, then you can contact us there, and we'll aim to get back to you as quickly as we can. We are now going to move into the question and answer portion of the session today. So we've had a couple of questions that have come into the chat, so we'll kick off with those. And if you do have any further questions, feel free to obviously put them in the chat or raise your hand, and you can come in and ask them yourself if you would like. So the first one was, are we able to say who is in the leadership team for the East Sussex programme?
Yep, shall I take that one? So I guess we've got a couple of governance groups in place that provide the leadership and could be thought of as the leadership team. So we've got the Mental Health Oversight Board, and I think what Richard referred to earlier as the Operational Delivery Group. So there are two sort of key spaces where the work to deliver the neighbourhood mental health team model is being planned and overseen and scrutinised. If we talk about the Operational Delivery Group first, that is chaired by Andrea's colleague Martin Dominy, who works alongside Andrea as part of the BCSE transformation team in mental health, but it's also chaired by a lady called Laura Brummer, who is the clinical director for the East Sussex division of Sussex Partnership Trust. So there's that co-chairing arrangement, and within that group, there's we've got about 15 members, something like that, and it incorporates myself, Andrew, and Richard, obviously the chairs. We have other colleagues from SPFT sort of services in East Sussex. We have people from East Sussex County Council, lived experience representation through Ricky Perrin and Richard. So a broad range. Oh, and we have NHS Talk and Therapy is represented, and primary care represented as well through one of our GPs through East Sussex. So the Mental Health Oversight Board sort of sits above that operational delivery group. It's very similar style of membership in terms of the spread of system partners that are represented on that board. It's a bit bigger. We have people from district and borough councils on that meeting as well. There's public health, NHS Sussex, a commissioning body. So it's a spread, hopefully representative, system-wide set of leadership groups that are steering and scrutinising this work. I hope that's helpful.
Thank you, Ian. That's great. We've got a couple more questions. So more broadly around the neighbourhood mental health teams, will these teams be providing active interventions, or will their function be to kind of triage referrals only?
I don't know if you want to come in, Andrew, but I would say it's very much both of those tasks. So it's about bringing together all of the existing functions of community mental health service providers, including all of the VCSE functions and the SPFT treatment offers, and where triage is needed and where it forms a part of existing offers, it will continue to be a part of the neighbourhood team offer and continue to be a way in which referrals into the system are managed. And I think in one of the slides that Andrea spoke to, we showed that one of the new elements of the neighbourhood team model is that we want to make that process of triage a shared process across the system, so that when there are referrals that come through that is difficult currently for individual services to know how best to respond to the request that's being made through that referral. Often at the minute, that referral will probably get sent back to the person that submitted the referral. Quite often it's a GP, and for the person at the who's the subject of that referral, that can mean having to start their process of trying to understand where to go for support again. So we're trying to remove that barrier to access by bringing in these multi-agency triage processes that hopefully will ensure that when referrals do come through, and it isn't always straightforward to understand what the best offer for that person may be, that as a system there's a space that services come together and work it out and agree an offer to put forward for individuals at that point in time, without having to ask the GP to do anything more, without having to ask the person needing support to do anything more, that the system does the work in the background to come up with an offer that is hopefully appropriate for the person that needs it. So again, I hope that's helpful.
Thank you, Ian. That's really helpful. We've had a couple of questions in which are along a similar line, particularly around existing staff currently working within the ATS, so within the Assessment and Treatment Service, and timelines as to when we expect to be able to have some more concrete information for those staff as to what it's going to mean for them in terms of their working role, for example, their base, their workload, and kind of what the timelines are around having that information for those colleagues.
Yeah, it's a really good question and a really understandable question. I think there's lots of work going on within, so for SPFT staff particularly, there's lots of work going on within SPFT. I mentioned Laura Brummer has been really involved in this work, and she's working very closely with her colleagues and her sort of operational managers to start to pull together what might be needed to for SPFT to aligned to the new sort of neighbourhood model in the 5 footprints, and what a what a feasible way of moving towards that place could look like. Really recognising the need to be involving staff at every stage of that journey, really recognising the need to be understanding how changes to working practices might impact on staff. All of that work is being managed internally by SPFT, and I think Laura is leading on that. I think one of the first things they're trying to do is understand how demand is presenting across the different footprints, how it differs to the current sort of 3 ATS teams that exist currently, to look at how resources might need to match that demand across those footprints. I think Laura's enlisting some help from analysts within SPFT to help with that. So I think that's going to be the first step to get that understanding. And then from there, my understanding is that people like Laura, her colleagues Glenn and Tracy and Christine and Karen and others will start engaging with staff to talk in more detail with them at that point. So there's no firm timelines at this point. I don't think I can say around changing to any people's working terms and conditions or anything like that. I appreciate some of the anxiety that sits around that, but hopefully what I can put across is that there's not going to be any change tomorrow. There's not going to be any change, without people having been properly consulted and discussed and been made aware. So it's all still work in progress. But what we hope that we can start doing and can bring staff on board with in the meantime, while those really important questions are considered, is around, in the meantime, how do we start helping staff within the system start talking to each other in the ways that we know that they really need to as part of the neighbourhood team model? How can we start those conversations going on before any of these more structural changes might need to be made? So we hope that we can do those two processes in parallel, but really, really open to hearing about staff anxieties and how we can help manage those as we move through this process of change.
Thank you, Ian. And what I'll do is in the email that I send around later on, I'll include Ian's email, as I know also you previously mentioned, if we could share that. So if anyone does have any kind of questions or queries for Ian or the operational group that can then be taken back, then please do get in touch with us. We really want to make sure that at this stage we're helping people to feel informed and equipped with the information that they need. So if there's something that's lacking that would be helpful, please do let us know, because then we can obviously work on developing, whether it be additional information or resources or whatever that might look like. So please do let us know, because we recognise that change can be unsettling, and we want to help support people to feel well informed about what this means for them and their role and the people that they work with. So thank you, Ian. That's really helpful. Just having a look at the chat. Is there work going on to address support needs for people with both physical and mental health conditions? And how will these needs be met in the new neighbourhood model? For example, people with a brain injury or stroke. It can be difficult for people with comorbid difficulties to access the system the way it is at the moment. So yeah, if we can speak a little bit around that.
Yeah, do you want me to pick this one in, or just chip in as well if that's helpful? So yes, I mean, definitely that's one of the sort of fundamental things that we wanted to ensure with the new model as well. And as I mentioned at the beginning, we did do some work to ensure that with the footprints that we are going to be aligning with the integrated community teams piece of work. So ensuring that we have that much closer link with physical health services, and particularly within how we structure our neighbourhood mental health teams in East Sussex. When we were looking at what services would be part of the neighbourhood mental health team, we are ensuring that we are considering those physical health service teams and where they will sit. So particularly around older adults, thinking about kind of the frailty teams, thinking about the physical health teams there, but more widely as well for the whole of the adult population. So ensuring that we have that connection, and they definitely will be part of the neighbourhood mental health team going forward and where they'll sit. So we're thinking about kind of those aligned services that I mentioned, making sure that they form part of that. And we have much better and stronger connection to them, because we know that mental health, it doesn't happen in isolation. We want to ensure that people can get all of their different needs met kind of when they are unwell or need support. So building that relationship and making sure that it's wider than just mental health, that we're working closely with physical health teams as well going forward. I don't know if there's anything you want to add, Ian, in relation to that, but it's definitely kind of crucial, isn't it, going forward?
No, absolutely. I think you summed that up perfectly. But yeah, as we move forward, we want to make sure that people whose needs are more complex and whose needs don't necessarily fit into the neat little boxes that services have been positioned within over the last few years, can start to get a much more joined up offer across not just mental health, but across the whole health and care system in East Sussex. And so really linking what we're doing around neighbourhood mental health teams with the work around integrated community teams absolutely is the way that we're trying to address some of those difficulties, within the limits that we all have to work within in a pressured system.
Thank you both. There was a couple of questions and comments in the chat in relation to the size of some of the footprints and the populations that they will be supporting. Is there any kind of plans to, obviously once neighbourhood mental health teams are up and running, for that to be kind of an ongoing thing that obviously we look at to make sure that's kind of feeling right in terms of size? What's kind of the plan around that long term?
Yeah, again, really good question. Something that we have been very aware of from the minute that we looked at this as one possibility of arranging footprints. There's no specific plans to necessarily change the way that footprints are being looked at this point in time. However, we know Weald in particular is big geographically, and it's big in terms of its population size. Rother is big geographically, but its population size is a bit smaller. We will keep it under review. We are keeping it under review. I raised it at the Mental Health Oversight Board just last week, that it is something that we probably would want to come back and look at again, and particularly the Weald and population size and the ability of a neighbourhood team to really take a neighbourhood focus in a patch that is that big. So it is something that is being reviewed. It's something that I will ensure it remains on the agenda within that operational delivery group and the oversight board to keep thinking about. But yeah, I think it's about just seeing how things work out and changing and adjusting in response to how we see things land as we move forward.
Thank you, Ian. And I really like this question. I like all the questions, but I really like this one. What does success look like? So what are we aiming for? When will we be able to say, we've achieved what we set out to achieve? What does that look like?
Do you want to take that one, Andrew? I guess we well, you don't have to, but I was just thinking about the metrics work that's been going on and the way that we've been trying to measure, exactly that, measure what are the outcomes we want to achieve and how do we know if we've achieved them. I guess I know you've been involved in a lot of that work.
Yeah, definitely. Yeah, I think that's it's another really good question, something we've really considered both to sort of at a system level, but also at a place-based level. And yeah, Ian, I'll talk to kind of what we've done at system, and then if you want to talk about the work at East Sussex, that would be quite nice. But yeah, really good question, Mary, because it's really important that when we do this, we ensure that we're actually thinking about, is this going to make a difference? Is it making a difference? And making sure that we are actually really measuring and look at the effectiveness of it going forward as well, that we are improving things for both sort of service users and for staff. So something that we've done kind of as a central team, thinking about kind of Sussex wide, is think about those kind of high level kind of metrics that we want to kind of record and sort of be able to analyse and evaluate so that we can ensure that the new model is having a difference. So we've come up with a list of kind of 12, and there's some that we have to kind of think about measuring that are kind of imposed on us from a kind of NHS England level. So thinking about some of those kind of more quantitative measures around the number of people that are accessing support and how long they wait. But we wanted to also think about kind of the experience that people are having and making sure that is improving. So thinking about service user experience and also staff experience as well, working within the system. So we've got some of those more quantitative ones, but we've added in about kind of thinking and making sure that we're looking at it much more qualitatively around kind of how are people experiencing it and how do they feel about the support they're receiving. Also around carers' experience as well. We know that's really key. So not just the service user, but carers and their families, and thinking about those kind of satisfaction scores, but how they're experiencing and what their feedback is around the service. So we've got a kind of list of 12. We wanted to get that balance right between being able to measure the effectiveness, but not having so many that we're just recording things for the sake of recording. We wanted to have a list that would then be able to analyse and evaluate and really draw from, going across kind of the whole of Sussex. And then, as I mentioned earlier, what we've done then in East Sussex, think about how we might then measure how we're doing at a local level and think about things that are important in East Sussex. So thinking about our population need and the people that are using services in East Sussex and how we might measure the effectiveness there. So Ian, you've done some work, haven't you, to develop some of our kind of East Sussex measures too?
Yeah, absolutely. So I know Mary's on the call today, and she's part of the Transformation Partnership Group, and we set up a little subgroup to look at just this question, really. And that's the thing, it's success can be shown in many different ways. There's lots of different things that we're trying to achieve. I think being able to see people wait less, wait for a shorter amount of time before getting an offer, seeing fewer people have their referrals turned away with no offer being made, seeing more opportunities for organisations to work together, seeing more shared care plans being established and provided. All of these things would point to a level of success. And in East Sussex, we've talked about the idea of trying to improve access. I've talked about the survey that we're using to try and understand what it's like now and how we can improve on that. So that would be another measure of success. In 6 months, 12 months time, if we go out and ask people again, does it feel different? Do the experiences, are people saying still that they're not being able to access a service because they've got a comorbid drug and alcohol condition, or because they are not being provided an offer that they can actually get to in terms of where it's being delivered from, or has some of that started to change? All of these things would point towards an overall measure of success. So it's about bringing together that whole range of different metrics and indicators that can help us get a sense that things are different, and that the problems that we've set out to address are diminishing in their impact for people.
Thank you both. I think that's really helpful and hopefully answers that question. So we're coming to the end of the session now. I don't know where this past hour has gone. So I'd really like to thank our presenters, Ian, Andrew and Richard today, for the presentation they shared with us and for responding to the questions that have come in. And thank you to everybody who's attended today. I hope that you found the session informative. There were some really fantastic questions that came up, which we'll be able to take away kind of as a central programme team, but also thinking locally, obviously for East Sussex, about what else we can be doing to make sure that people feel really informed and supported throughout these next stages. So do obviously get in touch with us if there was anything else that you wanted to ask. I've put Ian's email address in the chat, but I'll also include it in the email that I circulate around later today. Do also feel free to get in touch with me if you have any questions, and if it's not something I can respond to, I'll obviously direct it to someone in the team who can. But yes, just thank you so much for coming today. Please share the recording with anyone else who you think would be interested in watching it back. And please do join us again next month. We'll be back on the 21st of August. We'll be hopping over to West Sussex to hear about their progress and developments there. So thank you all so much, and I hope you have a really good rest of the day. Thank you.
Thank you, everyone.
Thank you.
Take care. Bye-bye.